If you have ovaries, you should know. This is day 5 of my series posting about GYN things you should know to better advocate for yourself. So if you have ovaries, you should know that every GYN exam does not require a pelvic exam. I made this pizza myself. It's really good. So let's say you go into the GYN and you notice something in your breast. You did a breast exam. Does that require a pelvic exam? No, it doesn't require a pelvic exam. Or you go to the GYN because you've decided to start birth control. You're getting an implant placed, and then the one that goes in your arm. Does that require a pelvic exam? No. So when you're trying to figure out, is this normal? Is this not normal? This is something to think of. Does it make sense that this would require a pelvic exam? In many of the cases where providers have essayed patients, one of the common things is unnecessary exam, meaning I went in because I said that my throat hurt and they did a pelvic exam or they did a breast exam. Does that make sense? Probably not. Also speaking to that, and I'll do a separate video that goes more into this, but for any exam that's done, any touching of your body, consent should be obtained in some way. They need to tell you that they're going to touch you and ask if that's okay. Sometimes they might just say, hey, I'm going to do a pelvic exam. And that's your opportunity to say, I'm okay with that, or no, I don't want a pelvic exam, which you can also say. So know that just because you've scheduled a GYN visit and you're in there for the appointment, it doesn't mean that you have to have a pelvic exam.